I'm Tom Paws. I was the interim executive director here from July of 1999 to sometime in 2003, and then came back in 2005 to assist before Joanne was made executive director.
I'm Don Ingalls. I was a member of the board from 99 to 2005, and then served another 2 terms after being off the board.
Don and I sat on the board of directors for the Mental Health Association of Western New York. And after a meeting, I believe it was in May of '99, we were walking to our cars and Don said, "Gee, Tom, can you give me I know you're retired, can you give us a hand? Our executive director's leaving and we could use your assistance as a caretaker for a couple of months." Well, I said, unfortunately, I said yes. And arrived here in July 1st, 1999.
Tom came on board agreed after, as he said, after he agreed to come on as a consultant. And he started in July of '99. And at the end of that first week, it was a Friday, and Tom called me and said, "You have to come over here right now." And I said, "Okay." And I came over and we sat down and he said, "Don, there's no money. The organization has drawn down all its federal grant money for the whole year. It was only in July, 6 months left of the year." He said, "There's no more federal money to draw down. Patient revenues are catch as catch can, and they're coming in. We need to clean up the billing system. The only thing that I can think of to do, because no banks will give us money, nobody would give us money, is to have a voluntary salary reduction plan for a period of time to get us through the year." And I gulped and said, "Well, okay, how would that work?" And he explained how that could work. And then he was able to, we agreed as the board, and that's, he put it into place. And it worked, and Tom can tell you more of the details of that, but we only lost a few people, and everybody was on board, and it was quite a dramatic thing, but it saved the organization.
The organization was very similar to the one I was previously associated with, salaried physicians taking care of people in a timely fashion with the right type of provider. So it was very reminiscent of what I had been doing for the previous 18, 19 years. The only problem was when I looked at the books and the way the processes were working in the organization, they hadn't made the adjustment from the previous way of financing care, which was primarily through Medicaid and a visit rate, to a managed Medicaid and a procedure reimbursement rate. So there was very little attention to the fact that you got paid based on a code that you chose that represented what you did with a patient. And as Don said, to get from here to there was only one mechanism that I could think of, and that was having everyone do a voluntary salary withholding. And we tried to promise everybody that if everyone did what they were being asked to do, all that money would come back and the organization would survive. I think the key to the survival was the dedication of the provider staff and the support staff to taking care of people in this organization and the neighborhood. It really cemented them into valuing the organization, and it was then up to me to lead them to make it financially viable. So we put in a salary reduction program commensurate with what the salaries were for individuals. Each class of staff had 3 things to do. So they had very specific oriented actions which would result in our being able to see more patients, bill appropriately, and taking care of any of the receivables that may have been rejected by the insurance company. At the same time, we were educating our providers and support staff on this new methodology of actually billing by procedure code as opposed to the visit. The board looked at a balance sheet which looked very robust, a couple $1 million. Unfortunately, it was all in receivables, so we did not have the cash. So part of the effort was also to rework those receivables through the business office to make sure they met the qualifications of the insurance company so we could get reimbursed. And that's how we moved forward from August through the end of 2000, I think it was, that we actually kind of turned the corner. The new grant year came in January of 2000. And we were able to have everyone's salary back to where it was negotiated, where it was promised, as well as the back withheld wages from the first couple of months. And I tried to be the leader there. I wasn't paid for 2.5 years. Luckily, I was retired and could afford to do that.
It was really quite an accomplishment. I'm still in awe of it to this day, so many years later, that the organization was really on the ropes. I mean, as Thomas said that in that phone call, there's no money, and the staff commitment, as Tom noted, was to the organization and really worked hard. And it's a wonderful story and a wonderful commitment that the staff had, and the organization then was able to restore the outstanding debts to the staff within several months after the new year. So it's a tremendous thing, and it's part of the legacy, I think, of this organization. And it's important for new staff to understand that history as well, I think.